meaningful to them. We talked about two-way communication, meaning we're not just giving the information, or parents aren't just giving us information, that it's a two-way street, and that we're communicating in a manner and in a language that matches parents' home language. We talked about volunteering. So again, we can see that that fits in with the agency level decision making. Epstein talks about learning at home. So sending materials or ideas home for parents to try different things and have fun with their kids. Decision making. What kinds of things does your agency need? Every program, every provider has a different culture of families, and so we want to provide the things that support those families. And then collaborating with the community, and we'll talk a little bit more about that in a minute. We talked about how other agencies, Head Start, NACI, Strengthening Families, all look at parent engagement. We looked at what their criteria were for parent engagement, and then we looked at what the Wisconsin Family Engagement Guiding Principles were. And if you remember, there were 13 of them. They were divided into roughly 3 different kinds of categories. First one is what programs can do to engage families. That included things like training staff in family engagement practices, probably one of the reasons that you're in this webinar. Respect, embrace, respond to the unique needs and strengths of culturally diverse children, families, and communities. Helping staff to understand trauma and how to support families without judgment or prejudice. Offering family education on appropriate expectations, learning activities at home, creating plans for families transitioning both in and out of our programs. The third area was how we are going to partner with our parents and our families, setting up consistent two-way communications that promotes their primary language, exchanging knowledge about the child's daily life, and that means what happened in our program and what happens at home. Collaborating for establishing goals for kids. So we're not the only ones setting goals for kids. We want to do that in conjunction with our families. And then the third area was community support. And how does that look in the bigger community? So having working partnerships with family support agencies, supporting families with known community resources. So when families come in with unique situations, we might know where to send them. That doesn't mean that we have all the answers, but we know where they can go to get more help or support. We spent some time thinking about which one of these practices you're good at in your program and which ones you struggle with. Did anyone want to share what you're good at or what you struggle with in those guiding principles? Are we getting any response?
Not yet.
Okay.
There's a couple questions about the handouts, and I did want to say that the handouts are you should have access to them up on the top of your screen right now. I will also email all of these. If somebody doesn't have access to a printer, we're happy to print a set and mail them to you. Just let us know.
But for right now, what Jean was just reviewing, there are not handouts. Today.
Correct.
Right. Okay.
Right. These are the things that we talked about last session. Okay.
Will you just repeat the question?
The question is, when we looked at the guiding principles, the 13 guiding principles, which of those principles are you good at right now, and which one of those are you going to struggle with, or will you need to do some work on?
So Deborah says, we're good with parent-teacher communication through daily sheets and interactions.
Okay. That's a good one. Anyone else have anything to share? Okay.
Brenda says, I struggle with the staff communicating with parents.
With the what?
With parents.
Okay, so staff communication with parents. Okay. Hopefully the session today will help you a little more with with that.
And then just one more, working on teaching strategies and understanding them.
So in the
Okay.
classroom.
So in the classroom with the children?
Not quite sure what you mean, Jody. Yes, so
Okay,
classroom.
Okay, so good.
So that sounds to me like supporting families by meeting the needs of children in the classroom.
Right.
Okay.
Right. All right. We also talked about the ladder of influence. Do you remember those? It was inference. Didn't I say that?
Sure.
Okay. That was I kind of look at that as the subconscious way that we think and interact with people. So it starts with what we observed going on. And that's a very subjective kind of a thing because almost all of us can look at the same situation and see something different. It goes next to the data that you select. Okay, so you may see the same things as other people, but you select different data to focus in on or to remember. What do you pay attention to? And then the meanings that you put to that data that you collected in your head. Okay, what kind of meaning do you have to that? And I'll give you an example of that. When I was teaching, I had a parent who never came to any parent meeting. She didn't answer any notes. She just never communicated with me at all. And I used to send notes home every single day with her older children, and I never met this woman. Like 10 years later, I meet her in Walmart, and she jumps up and says, "Mrs. Labana, oh, this is Kenyatta's teacher. She was the best kindergarten teacher." And I remembered the name Kenyatta, but I'm thinking, how did this woman even know who it was? Because I never met her. She thought it was just wonderful that I sent her notes home every single day, where I was coming from a place where I'm thinking, wow, she doesn't even care. She doesn't ever answer me. She doesn't care anything about her child. So the data that I was selecting was that she didn't answer me. This parent was seeing it from the point of view that I was communicating with her. So I put a different meaning to the not answering than she did. The assumptions that we make, and I made a pretty bad assumption on that one, and we all do. And then the conclusions we draw, the beliefs that we have from all of those, and then the action that we take on those. So if I had the assumption that she didn't really care 2 bits about her child, I probably would have stopped writing notes, and that wasn't the case at all. So we're going to talk a lot about that and about how we interact with parents tonight. We talked then about adverse child experiences. We sent you a link to look at some informative videos about ACEs, and I'm hoping that everyone had taken some time to watch that short video. We talked about finding your ACEs score and what those traumas in childhood might look like. We looked at a Wisconsin map, if you remember, the colored Wisconsin map that showed data county by county on the levels of ACEs reported. And I think the interesting thing about that was even the lowest counties were still 10% of adverse childhood experiences, which is a lot. 10% of that is a pretty high level, I think. Even one of those things that we read on the list would be a pretty significant adverse experience. It also might be interesting to think about ourselves and how much adverse experience we bring to the table. So not only the parents, but what we have. And if we've had some crummy experiences growing up, it colors the whole way that you look at life and other people and experiences. So tonight we're going to talk a little more about toxic stress in parents and how it affects their interactions and maybe even their parenting skills, and how we can be the best advocates for their children in those situations.
Are there some questions, Andrea, that have come in we should address before we move on?
There's one that I think just goes back to your first question. Deborah says we're good at meeting the needs of the children in the classroom, but struggle with making sure parents follow through.
And I think that's a pretty common kind of a thing. We're, as early childhood people, we focus on kids, but we have to remember that they come as a package in a family. Yeah.
Okay. Well, hi, everybody. This is Rebecca. It's nice to be back with all of you. And thanks, Jean, for doing that little refresher from last time. So the first thing that I'm going to go over with you today is a little bit about trauma. And this relates to the ACEs. When we were originally planning this webinar, we thought that we would have gotten through the next several slides right after we introduced the ACEs, but it took longer last session than we anticipated, so we're kind of covering that today, but it does go along with the ACEs. And so we're going to look at trauma first, and you do have a handout that's accessible to you for this, and I believe it's the one, it's got MMC in the title, which stands for Making Meaningful Connections. Just so you know, in case you want to Google that, because there's a wonderful handbook that is available as a PDF online if you Google that. So first of all, just to identify some types of trauma, there are types that would include physical abuse, sexual abuse, emotional abuse, chronic neglect, family violence, and community violence. When we think about these as ACEs related to the parents that we're working with now, these would probably be past traumatic events for them, like the physical abuse or sexual abuse, chronic neglect. That probably, if it is something they've identified, it's probably from their past. However, some of these obviously could be ongoing or current issues that are traumatic. And traumatic events such as these have an effect on how adults parent children. These things could impact their ability to make decisions. They might not feel comfortable with being able to sense danger or things that are not appropriate. They might not trust you, even you, the child care provider. They may struggle with that. They may have trust issues with their partner or their spouse or with their own children. They might have a difficult time regulating their emotions. So you may see that somebody who is either quick to get angry or quick to get sad, or maybe you never see any emotion at all because they overregulate their emotions. Some parents cope with ongoing stress and past traumatic experiences by engaging in substance abuse behaviors or other high-risk behaviors. And then, here, not available or shut off. This is what I already said, where they may overregulate and just not allow themselves to show any emotion at all. If you use this handout, you will see that there are some, I forgot to forward the slide, sorry. But you would see on that handout, and you can print that out, say that, that there are some ways that you can help parents. And those are on that for your opportunity to refer to in the future. Next, there's been some research done, and this shows some additional effects and the impact of trauma on a parent or caregiver. So maybe there's a reduced ability to empathize with their child, decreased capacity to recognize danger or stress. Sometimes you may have heard the term parentification, or where the child takes on the role of the caregiver, and I know I have seen this myself, where a child, often a firstborn child, will assume the role of caring for the parent who is either depressed or not there much of the time. And although on some level that looks like a good thing. They pick up the slack and help care for younger siblings, or maybe do grocery shopping or learn to cook at an early age or whatever. It's really not, over the long haul, a good thing for a child, because it doesn't allow a child to have a childhood. So trauma could also decrease an ability to listen to a parent's, their own child's distress. It might either trigger memories of the trauma for themselves, or just creates more stress. And that also leads to the next bullet, where the child may be a source of trauma for the parent. And a parent could possibly have difficulty tolerating a child's sadness, anxiety, or aggression. Many parenting behaviors or patterns are learned, as you know. And so in the absence of good role models, some adults don't develop empathy or sensitivity to their own children. And so it's possible that you would see these effects in parents in your program, and notice that the relationships that some parents have with their children are not as warm and nurturing and supportive as they could be.
So Jody's asking, could this have to do with a parent wanting us to force a child to eat or drink a bottle?
It could, and some of that could be cultural too, and we will be talking about family culture a little bit later. But yes, I mean, it's possible that somebody in their own childhood, I know, okay, so adults who grew up during the Depression, my stepdad was a child during the Depression, and he often talked about how kids were told to clean their plates, you know, because food was scarce. And then when he parented his children, that was something they emphasized when his kids were young, that they had to clean their plate before they could leave the table. And then they learned that, and their children are now the ages of my children, and you know, they parented very differently around food than I did, where it was never, I never worried that much. My stepdad was much older than my mother, so the way I was parented didn't have to do with her growing up during the Depression, because she didn't. And so there wasn't the same emphasis on, you know, cleaning your plate. So definitely experiences from childhood, whether they seem to be traumatic or not, can inform how we end up parenting. But with trauma, I think the way that we see this, and we've heard this a lot, is that, you know, somebody who was abused as a child may grow up to be an abuser, or somebody who grew up as the child of an alcoholic parent may end up with a substance abuse problem of their own. Or another way that might manifest itself in their adulthood is that they know how to relate to people with those problems, and so they end up in relationships with people who look like the adults that were in their life when they were younger. And so it's not uncommon for somebody who grew up in an abusive home to be in a relationship with somebody who's an abuser, or somebody who grew up in a home where substance abuse was common to then be in a relationship with somebody who is also a substance abuser. And these things, although they may not continue to experience the same trauma from their childhood, it might be different, but it could still be ongoing. And these types of relationships and these concerns have an ability, or have an effect on their own ability to parent their children. And certainly, if the home has these issues ongoing, then these children are now growing up experiencing trauma on a regular basis. There are other influences that you wouldn't necessarily think of as trauma, or some of us don't, like co-parenting or divorce. I grew up, my parents got divorced when I was a kid, and so because I lived in a home for some years with one parent, I didn't tend to think that this was such a big deal, because I experienced that before. But a divorce is a traumatic event for children. Co-parenting, especially if two parents don't get along with each other and have to speak through attorneys or something, that can be very difficult. Somebody who has to work a lot, maybe has to work more than one job, maybe, I'm aware of families where there's people working 2 jobs, both parents are working 2 jobs, and they're just not around that much, and that obviously has an effect on their ability to parent. Domestic violence is obviously a trauma, and it's ongoing. A family that has a child with special needs, that sometimes is considered to be a traumatic event, and usually when a parent first finds out that they've got a child with special needs at the time the baby's born, or maybe now even before that, it's a shock, and it's something that they have to adjust to, and it definitely changes the dynamic in the home. Maternal depression is another big one. We've heard a lot about that in the last 10 years with postpartum depression things, and then also economic struggles. And I would suggest that poverty is at the root of a lot of other things. Poverty creates stress. It creates a place where maybe parents need to work more than one job. Stress can lead to domestic violence. It can certainly lead to depression, not postpartum depression, but that's, other kinds of depression and anxiety issues are related to that. So these are some of the traumatic events or results of trauma that have an impact on parenting. And now Jean is going to share some other information with you.
So trauma and ACEs affect people in many different ways, and sometimes it's not even the way we would think it is. An experiment was conducted, and mice were trained to be sensitive to the smell and be scared of cherry blossoms. Their offspring pups who had not seen the parents react to the cherry blossoms, so they weren't learning this behavior. They were exposed to them, and they reacted in fear to the cherry blossoms as well. This experiment showed that trauma can be passed on to the next generation genetically and not just through behavior. Those perceived threats that kids sometimes come with raise their heart rate, their blood pressure, they release stress hormones, and they make it extremely difficult to learn. You can't learn when you're in stress. Where do we have stress? Sometimes programs that are, you want to flip it? Oh, I did. I clicked it. It didn't go. Sorry. Okay. That's okay. I just give you the look then. Yes, thank you. Yeah. So programs that are culturally incongruent with families can cause stress also. Okay, so on the chart that we have here are 3 different groups that we looked at some traditional things that we think are developmental in infants. This is in infants. We don't know who the 3 groups were, but we know that they were similar. Okay, so let's look at some of these. So eating solid food. Okay, one group thought by 8.2 months you should be eating solid food. One 10.1 months. Another one 6.7. So there's about a 4-month difference there. If our program decides that all infants start eating solid food at 4 months, you can see how much stress that is for a family that doesn't believe those kinds of things. So the things that we think are normal and natural developmental things in children sometimes don't match with cultural expectations. My husband is Asian, and their beliefs on raising children are pretty different than mine. So there's lots of stress in our family, needless to say. For example, my husband's grandma just gloats on the fact that his feet did not touch the ground until he was 2. So to them, it would be disrespectful to put a baby on the floor. So obviously they didn't get any floor time. They were babysit in their caregivers' laps until they're probably 3 or 4 years old. They don't get down and move around. They don't eat by themselves in high chairs. It would be, paramount to child abuse to let a child pick up his own food and put it into his mouth. And that carries over into adulthood, and I won't go into any of that here, But we know that all families differ culturally, and sometimes those are what I call the big C's, which are the ethnic or racial kinds of things. But there's also the little C's of culture, of what goes on in your homes. And for instance, we looked at some of the things before, but you have different expectations in a home based on the age of the parents. And I'm sure that all of you can agree that younger parents raise their children much differently than older parents or even grandparents, or where they live. So kids that grow up in rural areas have very different expectations than kids that grow up in the city. We have even neighborhoods are very, very different in terms of what we think are expectations of development. So as professionals, we need to be aware of those cultural differences and what's typical for a cultural child development. So knowing that when you were talking about a parent forcing a bottle or wanting their kids to have a bottle, that might be, that parent's culture demands that kids are fed, and that's the way you feed them, is by forcing a bottle on children that don't want to drink. So a little conversation sometimes, or understanding where that belief is coming from, goes a long way in understanding families. What?
So I would just like to interject here that if you are already involved with Youngstar, this for the 2016 rating cycle, you might have already had a chance to review the evaluation criteria. And one of the new points this year is the developmentally appropriate practice point. And in that, there's a requirement that programs actually get some information from families in order to best meet the needs of the children. And there is a requirement that it includes some family culture information, so that that if your general understanding and expectation in your program has always been that, well, at about 6 months we introduce, or we plan to introduce solid foods to infants, and by a year we transition them into the next room and they start taking only one nap a day, and you start making some of these changes that make things in your program run along a schedule, you might find that some of those aspects of your programming are not compatible with what the family's cultures are of the children in your program. And so once you have information about what these families expect for their children and what they've done with parenting them, you may find that you can make some changes in how you approach care for those children to better meet the needs of those kids and to be more in line with what families are doing, which provides more consistency for those children. Right. And they'll feel more stable and secure. And one thing that I realized when Jean was talking to me last week about her husband and how he didn't, his feet did not touch the floor until he was 2, and he didn't eat by himself until he was 3 or 4, is that obviously children are going to develop the ability to walk and feed themselves, even if somebody does it for them longer than we might prefer for that behavior to continue. And so what we think is right may not always be right, and generally speaking, kids are going to continue to develop whether they're held or not, and we have some beliefs about what's appropriate, but the families have beliefs as well, and we should honor and respect those.
Well, so here's kind of a related question. So
Sure.
Is it appropriate to share development information with parents to help them see what they should be learning at different ages?
Absolutely. Absolutely. But you also have to respect where parents are coming from. So you might want to show them what the norm is and what other children at that age are doing. But that doesn't mean that we all raise our children the exact same way.
And also remember that showing parents or giving parents information about developmental milestones and expectations is, you are going to be giving them a range. From birth through 5 or 8 years of age, Development happens on, in a range. And so not all children roll over for the first time when they're 3 months. So if they don't do it by then, they're failing. And not every child crawls by a certain time or walks by the time they're 1. And so some of that could be a delay because of family culture. Some of it could be just that child. My 3rd child didn't crawl until he was 10 months, and I was very worried about that because both of his older brothers had crawled much earlier, but then he just got up and walked.
Yeah.
Where my other kids crawled for much longer before they walked, and that was just a developmental thing, and it was totally normal for him. So sharing the information about developmental expectations is not the same as telling them that they should be that they should be allowing or forcing or requiring their child to begin doing these things. So I think it's always appropriate to share information that has been researched and that there's plenty of science to show that this is the general trend for children, with the understanding that parents may choose not to follow some of those expectations for themselves because they prefer to raise their children a little differently.
It also means that it makes it a little more challenging in our programs to be respectful of views that are different than ours, but that's what developmentally appropriate looks at. All right, so we have the tip of the iceberg, and this is what dealing with our families is about. We only get to see that little tip on the top end, and we don't know about all of the things that are underneath. That relate to culture and trauma and all the other issues that impact families. We only see that little bit at the top. So we want to make sure that we don't make assumptions based on the tip of the iceberg that we see. All right, so do you want to flip it? So you have a handout that's called Let's Think. There you go. We're going to do some thinking about where you are in this. So I want you to take a few minutes and think about a family that you're struggling with. And I'm sure that you all have one right on the tip of your tongue here. Think about the specific behaviors that you're struggling with that family and look at the first 3 questions. Let's just take about 5 minutes, 10 minutes. Yeah. And think about those first 3 questions. What are the behaviors that you're struggling with that family? How do you feel this is happening? How does this play into your ladder of inference? What might be some of the causes or functions of that behavior that you're seeing? So take a little bit of time to think about that. We'll take about 5 minutes.
Are we off mute yet?
Yeah.
Okay. So this is Andrea. Rebecca just asked me to try and summarize some of your questions, which is challenging me, but I will try and do my best. It does seem like there are several more food-related questions or issues or challenges, and so I would say that that's
And food is a
theme.
loaded cultural question, so that's probably why we're having lots of those.
There's also so one challenge is a boy that is pushing a lot, and she's wondering if that's developmental. He's a 2.5-year-old, or.
And I will say this from my own experience as both a parent and somebody who worked in a group child care center for years. Often, and I especially noticed this with my own children, that they were more physically aggressive when they did not have another way to communicate. They were more inclined to bite. So I noticed that once, especially my middle son, who is now, for the record, 21 years old and graduating from college.
Doesn't bite anymore.
He does not bite anymore. But he did, once he could talk, he just dropped a lot of the behaviors that appeared aggressive. But until he could actually communicate some way that somebody else could understand, that was how he communicated. And I believe that is why some of those behaviors are so common between the age of 18 and 30 months, because children are more physically capable, but do not yet have the ability to communicate in a way that other people can understand. And that's what they resort to. It's frustration is communicated with pushing or biting or pulling hair. Crying is another way. Usually we see that in younger children, but that might be what you're seeing. And so it's partly developmental, but not necessarily developing what you think.
And here's just a clarification. Can you just say a little more about what you mean by what might be some of the causes or functions of the behavior you're seeing? Can you just explain what you mean by that?
So if you go back to the first question, what specific behaviors are you struggling with that you see with a family or parent? So you've got this family in mind that you're thinking about, and you maybe have identified a specific behavior. And so, I mean, the next question is, how do you feel about it? But the third question is, what might be some of the causes of that behavior? So presumably you've identified a behavior that you think is a problem for you as either a teacher or a child care provider, maybe a center director who's trying to manage staffing in a classroom where there's one child who is a problem. If you walk that back a little bit, you've identified this problem behavior, and you've sort of said this family, we're struggling with working with this family. After we've talked about trauma and culture and other experiences that a family may be currently having, is it possible that you can identify something in there? Some traumatic event that you're aware of? Have parents recently separated? Has a parent been deployed overseas for military service? Has a parent ended up in jail for some time? Do you know that there's domestic violence and the mom took the kids and is now living in a shelter? Has somebody recently lost a job? I mean, could you point to some event like that in the family that might explain why a child may be acting out? I'll give an example from when I was a center director too. And this was in another state, so I'm not worried about these kids being anywhere around here. But Brad was a 4-year-old child in our preschool room, and he was fully potty trained, good communicator, everything. I mean, he was always kind of a handful, but, typical 4-year-old. And then his parents had a baby. And within 6 months of the time that Michelle, his little sister, was born, the parents came and told us that at home, Brad was going into the closets and urinating in the corner instead of using the toilet. I mean, it was clear at some point, everybody made the connection that he was acting out because he had a new sister and he was no longer the beginning and the end in the family. And so, looking at some other things, and that's kind of an obvious one, actually, but you might have to look harder or get some more information about a family culture before you understand some of these things.
Well, so is cause and function the same thing, or the function of the behavior is what it gets the child?
Outcome, I would say the cause. I mean, either one. Yeah, they're not necessarily the same thing. And so another thing that I would like to suggest to each of you, and I know this is something that's been important for me when I think about how I respond either to children or to their parents, or then, I'm not out in direct care so much anymore, so how do I respond when I'm dealing with other adults professionally? I have to consider my own background, and when I did the ACEs test, I actually scored very high on that because of my childhood, a lot of experiences from when I was growing up with my parents, and some of those things have made it difficult over time, or they've created their own challenges for me, like in my own relationships. But as I have worked on those things and how they've created or built my ladder of inference, I have become more sensitive to people who may have experienced some of the same things that I experienced in my childhood. So my childhood home was filled with a lot of physical abuse, and it was very bad, it was ongoing. There were 5 kids in my family, and all of us experienced a lot of that. There was also sexual abuse in our home, and just some of those things that could possibly make it difficult for me to parent my own children very well, or that could make it difficult for me to relate to other people. I could possibly have been in many dysfunctional relationships or something, but I worked hard to get past some of that, and so now I tend to be more sensitive to things where parents may have maybe experiencing those in their home, and it's impacting their parenting and the young children. And in some ways, I relate better to them than other people because I understand that. I understand some of the challenges of that. And so I would encourage you to think about how your ladder of inference is related to your own background, and where it might help you with some parents and where maybe it doesn't, and maybe there's things you can work on to make you more sensitive to some of the issues that parents have in your programs. Just like Jean is very sensitive to cultural issues because she's married to somebody from a very different culture. And so she's aware of things. When we were talking the other day, we were kind of laughing because she's experienced things that I've never even thought about. They've never been on my radar because I'm married to somebody who has a very similar culture, both ethnically and even the family culture that he grew up with is not dissimilar to mine in some ways. Luckily, he did not have a lot of abuse. But luckily, yes.
Well, and so I just would say, so there are several other anecdotes that are kind of related to the ones we've said. So if I haven't read yours, because I think it might be kind of like another one we read, but I will say that there are at least 5 mentions of frustration, or it is frustrating. And so I think if there's any way to address how people can manage their own frustrations with parents not following through at home, or parents questioning somebody's own judgment and own understanding, and so.
And I appreciate that people feel comfortable enough to share that they're frustrated, because I think often we feel like we're not allowed to be frustrated, not with the children, not with the parents, and I think it's a good thing to acknowledge that we occasionally work with families that are very challenging and with children that are very challenging. And we are going to talk about some ways to engage parents. I do want to let you know about a couple of videos that, unfortunately, because of because we're doing this in a webinar format, we don't have the ability to play these videos. Like we told you last time, we could play them, but you wouldn't be able to get the sound, or it's possible we could let you hear them but not show you the picture. So neither one of those would be a wonderful way for you to experience these. So you will receive by email a PDF of our PowerPoint, and it will have this slide in it. And there is, and so you'll have these links to these 2 videos. Both of these videos are between 2 and 4 minutes in length. Both of them, I'm telling you, are very valuable. Please, please, please take the time to watch them. They're easy to watch. The one on empathy will make you laugh a little bit. But I think that they're very valuable, and so I want to stress to you that when you get this PowerPoint, please take some time to look at those and maybe even save those for sharing with your families, or, well, maybe with the families, but also with staff at a staff meeting. I think you'd find them to be helpful. I do want to move on because we were talking about frustrations, and so we want to kind of move into what we call solution space a little bit, maybe some strategies for how to work with families and parents, caregivers, around some of these concerns. So first of all, I'd like for you, I know you just spent a little bit of time typing, but could you please look at this slide, and if you have a definition of genuineness, before I tell you what the definitions are that I looked up and would like to share, I'm just wondering off the top of your head, what does it mean to be genuine? What does it mean to have empathy? What does it mean to show respect? If you just would pick one of those words, type it into your chat box with your definition of it. Don't feel like you need to respond to all of them, but just pick one of them and let's see what sort of responses we get. We'll just do this quickly.
Caring. Real, not fake, equals genuineness.
Okay.
Excuse me.
Anything about respect or empathy?
Genuine is real, honest. Empathy is having feelings and understanding feelings of others. Caring. Showing love or being loved, genuineness. Being able to share feelings with another person, empathy, thinking of others first and what they are feeling. Similar one about empathy, being understanding, honest, and talk to people in a respectable manner. And empathy, truly understanding another person.
I'm actually very excited and encouraged by those responses because I think empathy is a hard concept. Genuine, pretty much, you all nailed that. I like to hear authentic, real, sincere. Those were the terms that I found as well when I looked these words up. And I would say, too, that genuineness is one of those things that you know when you see. You feel it. Sincerity, people have a sense for that if somebody's faking with them. And so this is important. If you know what it means, then you probably know how to be genuine. Empathy definitely is the ability to identify or experience the feelings of another. So I heard a lot of that. And empathy is not the same as sympathy. If you watch the video that I sent the link to, you'll see they make it very clear the difference between sympathy and empathy, and that would help you. But these are things that will help us relate to the families we serve. Respect. I like this definition, the sense of the worth of another person. So I know that was something that even before my kids could talk, I'm sure before they understood what I was ever telling them, I was always telling them that they had to respect each other. And I really wanted my kids to grow up and understand from before they were speaking that they needed to treat their brothers, I have 3 boys, so they needed to treat each other with respect. They needed to understand that each of them had value and worth in our family, and nobody was better than anybody else, nobody was worse than anybody else. So really having a sense of that. Proper acceptance and courtesy is also a part of respect. So thank you for sharing those. Part of the reason I'm really happy to hear that you all have such a good understanding of this is that you will find family engagement. Once you can find some strategies, it will be easier to engage families if you can use these character traits. Jean, did you have something to share?
No.
Oh, okay. I did want to share that there are 4 parts of empathy. These are things that you'll get from the little video on empathy. The first part is perspective taking. So being able to have the same perspective as another person. So trying to put yourself in their shoes. Another part of empathy is staying out of judgment. It's easy. Some people find it much easier to judge others than other people do, and I recognize that in myself. I'm quick to judge, so I have to be very careful to slow down and make sure that I don't assume something about another person or another family, but really just keep my judgment out of it. Recognizing emotions in others, that's the third part of empathy. And then communicating, being able to communicate in a way that's appropriate. And one of the things they do say in the video too is that often the most appropriate response, if you are being empathetic, is that you honestly just don't know what to say, or you don't have any words to say because you don't know what that person needs, and what you want is to be able to offer them comfort. So remembering these things when you're working with the families that are enrolled in your program, especially not judging, and each one of us could probably think of a family and when Jean shared earlier about the mom who thought that she was such a wonderful teacher to her daughter, but Jean shared that she had actually in her own mind judged this mother as not being involved because she didn't understand more of the background. I think it's easy to judge, and so it's probably one of the hardest things to stay away from with our families, and we want to remember that.
So let's look at some tools that we can use in communicating with our families. And the first one is an empathy response or empathetic response. And that is about conveying back what you heard them say. I hear that you're frustrated that Kiera's sweater is missing every night. Instead of saying, what do you mean it's missing every night? I don't put it away. She has to take care of it. You're coming back to saying, what are you feeling about it? And you're feeling really frustrated that every single night you have to search for that sweater. It also is identifying emotions. So if you remember empathy and emotions, so kind of identifying what emotions are you feeling here. I know it's frustrating every day when you come in and you can't find the things that you want. Or I know that you are confused by the way we feed your baby and the way that you do it at home. So those kinds of things. So we're standing back thinking about what are they saying to us and saying it back to them. And the funny thing is that when you repeat back to somebody what you heard them say, it clarifies where you're at. It takes that roadblock out of your head that says, I'm going to try to solve this right now, and you're wrong. Because usually that's how we do it. Communication helpers are the statements that open up communication. You have a handout called Communication Helpers. Do we have that on there?
Yep, it's on there.
Okay. So these are the things that, as I said, open up communication and ask for more. So usually they are open-ended statements, okay? They usually have something to do with your perspective on how you understand it. So they can start off with words that are like, I was wondering, I'm concerned, help me understand, how are you doing today? Those are, or I want to hear more about that. Very open-ended that ask for more information.
And one thing you will notice too with these is that even if these are the beginning of a phrase, there's no judgment in these. These are very objective. So if you use these kinds of questions or conversation starters, you should be successful in not having a family get defensive right away. Instead of saying something like, I heard that Johnny had a bad day, just asking a question, how's it going today? Or how did he do last night at home? Whatever. But, making sure to not start a conversation with judgment.
Absolutely. And these are good ones for that. I feel, or I felt, or I found that doing blah, 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 blah helped me, or what I've seen other families do is not saying, well, the right way to do that would be, well, what other people have tried, or what I have heard about, those kinds of things. Opening up that communication right away. Communication blockers, on the other hand, are the ones that blame them. Usually have the words of always or never, giving advice, because it always comes from my point of view. So if Kiara's losing her sweater and I'm saying, well, you know what, it's not my fault. She's supposed to put it in her cubby, and if she doesn't put it in her cubby, I don't know what to do. Where do you suppose a conversation would go after that? There's really no other way to go but fighting words. Communication blockers, again, always start with always or never. So what you never bring her sweater into the room. How am I supposed to know that she has a sweater on? Or I always tell her to put it away. So those are the kinds of things that are very up against the wall kinds of things. There's nowhere else to go with that. The last one is reframing. So taking a statement that you may have said, you've got that up there, good. It's one of your handouts, taking a statement that you have and turning it into a positive. Okay, so you can see, let's look at this one. She's in denial. Where do you suppose that would go? That conversation is going to go anywhere productive? Anyone? How could we change that into a positive form? Anyone have any ideas? Is anyone answering?
No, give them a minute.
Okay. They need to type faster than that.
Oh,
Because I always type faster than that.
Yes, no judgment there.
Yeah, right.
There says she's having difficulty understanding.
Oh, that's almost exactly what I was thinking.
Okay.
She isn't remembering.
She's having a hard time.
Jody says, I'm trying to type fast.
Yeah, you tell.
Susan, she doesn't quite understand.
Okay.
Nice.
Could be she doesn't see things the same way that I do. Okay. Let's go down a little farther. She doesn't accept her child's disability. What would be a positive way to put that? She doesn't accept her child's disability. We kind of put the monkey on her back because she's the one who's wrong. How could we put that in a more positive way?
Less judgmental,
yes.
something that would help this parent feel like she could even talk to you about how she feels about her child's disability.
Because even to say she doesn't accept her child's disability, put that judgment inside of me, and I'm looking at everything now that happens with that lens. So I want to change it to a more positive lens. How about?
So here's a couple. So she sees the good in her child. Okay. She's coping the best she knows how to. There you go. She's in pain.
Yes.
There you go. How about she has lots of hopes and dreams for her child?
Yes.
Okay. That maybe that disability is taking away, but she wants the best for her child. One of the things that I have learned in working with parents is if I look at it from the lens, and what I truly believe is that every parent loves their child to the nth degree. Sometimes they don't show it, but I know that they all love their child the very best they can. And if I come from that attitude, then I know that then I won't have these kind of judgments. So let's look at one more, and then we'll move on because we're running out of time really fast, aren't we?
Yes.
Okay. He has poor parenting skills. How would that make me feel about that parent?
That parent?
Yeah, and if that parent heard me saying that? He has poor parenting skills. Pretty judgmental, isn't it? Like I'm wonderful. Anyone have any ideas?
Maybe that parent had a difficult childhood.
Mm-hmm.
He just needs help understanding how to parent.
Okay.
That's one thing I actually encourage. Often when I'm out rating a program with Youngstar, and I hear a teacher say, well, parents want this, or the parents expect us to do this. And I often say, well, this is a really good opportunity for some parent education to share information about what's developmentally appropriate.
Because we have parents, as I said, parents always want the best for their kids. And sometimes they don't understand how to get to there. For example, having very academic programs. They think that that's going to make their kids better ready for school and more successful in life. And that's our job as professionals to tell them what the research says and what's good for what we know is good for early childhood. And that's a great thing. So for parenting skills, maybe there are some more ideas that you can offer to him. You know, we do come into parenting without any training. They just hand you that baby and say, bye. You figure it out.
So a couple of people just suggesting that be sure that we're connecting parents with the resources.
Yes,
absolutely.
Yeah, we're actually going to get to that too.
And we're going to get to those. Yeah, absolutely. Okay. Can you?
Yes, advance the slide.
Yep. So, nonverbal speaks louder than words. So, where are we in space? Okay, so if we're right up tight close to a parent, almost like in their face, that can say one thing. If we are far away and we don't want to get very close, says another thing. So where is that happy medium of where is that space? Look at the body language here. Look at the second one from the left on the top with the hands on the hips. What does that tell you? That I'm really open to hear what you have to say?
That's why that guy's running away.
Yeah. Or the hands on the hip and pointing. Whoa, that just pretty much tells you that I know it all and you just better back off. Okay. So look at how your body language talks to what you're doing. Look at the space that you have and work on that. We want to always make time for parents. But when you're supervising a room of 20 kids and a parent comes up to you with an attitude, there was a judgment, wasn't it? That needs to talk to you right away, and you're trying to watch the classroom and the parent. You might want to say to the parent, I'm really sorry, I am responsible for this classroom. Can we talk at another time? Or do you mind that I have to keep looking back and forth? But being very, very verbal about why you're not right in their face and talking to them. Okay, so did we forget the power of listening? How often we need to get that last word in or the first word in. The video on empathy really speaks a lot to being with someone and being right there with them, hearing what they have to say. And a huge step in relationship building is listening and hearing what parents are having to say. It takes focus, it takes eye contact, it takes connection, it takes skill in listening to what people are saying, because sometimes the words they're saying are not the things they're really trying to say to you.
This is where that reflecting back what you heard helps to provide clarity. Often, even if you say exactly the same words back to somebody that they just said to you and they hear them that way, they will clarify, because they realize when they hear them like that, it's not clear.
That's not exactly what I meant, right. Or I want something else. Yep. And it also clarifies it for you when you say it, and it buys you a little bit of time for listening, thinking, and reflecting, so that your mouth is not engaged before your brain is. So it kind of slows you down a little bit.
So after thinking about how we can listen and how we can reframe things and communication, I want to go back to this Let's Think activity, to the bottom two questions. How might you see the family that you've been thinking about differently? How can you consider your ladder of inference, and how does that impact how you're seeing this family? And what ideas, skills, or strategies from today's session could you try when you see this family next? So this is up here right now, and obviously we haven't talked about all the strategies and skills, and you don't need to type things here because I know we're running out of time, but I do want you to think about especially how you communicate with these families. I think that the reframing, the positive reframing, and that communication helpers handout would be really helpful for you as you just listen to yourself going forward with how you respond, and consider how you respond to staff as well. If you are a center director or if you're a teacher, how you talk to other teachers, because remember that all of this is modeling. It's modeling for the children who watch you. It's modeling to other staff people. If parents happen to be in the hallway and hear it, it's modeling to them as well. So I would really like you to spend some time on this, but not responding to us right now, because I do want to move on to a little bit, some strategies or some ideas for what you could do to help parents. First of all, how can you enhance their knowledge? What are some things that you could do? Like I just said, be a role model there, especially when parents maybe come in and to pick up their child and they're spending some time there, and you have the opportunity to actually demonstrate how you interact with their child, with other children, how you encourage their child to interact with their peers. All of that can be role modeling. Going back up to the first bullet, provide just-in-time parent education. So this might be an opportunity if you are the teacher in a 2-year-old room and lots of kids are demonstrating biting behaviors or other behaviors that are sort of physical acting out things, maybe pushing, maybe hitting, pulling hair. I mean, I've seen all of those things. And providing some information to parents about these behaviors that are very typical at a certain period of time or development for children. The third bullet there, arranging formal parent education activities. Some things that I've done in the past have been to have an opportunity where parents can come back to the center, and we provided childcare at no cost to them. And while, I mean, our staff got paid, but the parents did not have to pay for that. And while the children were involved in some special evening time activity that was not typical daytime childcare, the parents had an opportunity to listen to somebody we brought in talk about something specific. And some topics that we did in the past were exercise and different ways to engage your children in physical activity. We've done, and it's always been popular when I've done, had somebody come in and present on nutrition and feeding or preparing meals and involving kids in that. So, you know, having opportunities like that. Partner with parent education organizations. So possibly having a doctor's office be willing to come in while you have maybe an open house and they can do some vision screening, or having a dentist come and do a presentation on dental health. There are plenty of other parent education organizations out in your community. And if you would like more information about what is available in your community, I would love it if you send an email, and you'll get our email addresses again, but we can help you for finding those. But I would say the first place to start would be with your CCR&R, which is probably your local Young Star office. But definitely bring in other organizations that can help, and then share resources. We often see bulletin boards with handouts that are free to take about nutrition, about common childhood illnesses, developmental milestones, things like that. You could also set up opportunities for family meetings, have parent cafe opportunities where you can have somebody at a table, and then the parents can move around the table and ask questions of somebody who's sitting at that table who's kind of a specialist in some subject area. Having parent-child workshops where a parent and a child do something together. Possibly breakfast with buddies. This is not an uncommon thing. There's often something like donuts with dads, or, you know, a Mother's Day breakfast or something. But one of the things that I would encourage you to do is consider your community, especially the community of families that are enrolled in your program, and make sure that whatever you are calling a specific event doesn't leave out some part of the family population at your program. So if you have a high percentage of kids who are in single parent mom only homes, then you would maybe want to consider not having a donuts with dad event, but maybe a breakfast with buddies, so they can bring somebody else, and make sure that you're inclusive of other family configurations. And then you probably have other ideas. I know that there are some suggestions available if you want to email us. We just don't have time to go through all of this. We run out of time very quickly.
Every time. Every time.
Yes. So if you can't think of something, I would always recommend that you talk to your Young Start technical consultant. I would also recommend that if you have a rater, like if you've been through formal rating, that you feel comfortable reaching out to your formal rater from the past. And those people may have some suggestions for you as well. Don't be shy about networking with other programs in your area. I like to remind my own staff about how we look at the people we work with in our communities and around the state, and remember that we are all on the same team, and that's the early childhood team. We are all doing what we do because we really want what's best for young children. And so I know that it's easy to sometimes look at a program down the street or across town as your competition, and I understand that in some ways they are, but also they're on your same team and might have some ideas and strategies for how to connect with families in your specific community that would be very successful. Jean also has some information about how to connect with community partners.
So with all the resources that are in your community, so we start with school district, we have private, you have the public schools. They do a lot of the early childhood programs. They may have a rec department.
Thank you.
And they have lots and lots of resource people. So when you have questions, your local school district is one of those places you can go to. Head Start programs and early Head Start, they do lots of parent involvement and things like that. So even if you're not in Head Start, they do some screenings, they do some activities in the community. Your health department does developmental screenings, they do health screenings, they have family support groups. They know all the resources that are in the community too. So if you're looking for a certain resource, probably your health department is the first place that you're going to call. Family resource centers, so they are in all different forms and fashions. They do parent education, they do activities with families, they have home visitors, they have lots and lots of things. And they're also open to if you need something of relating to you that way. Home visiting programs start with, there are programs, and they're called different things in different communities, but Parents as Partners, Birth to 3 programs, health departments do some visiting, things like that. The library is a wealth of information on both literacy, but literacy programs, so come and read with me kinds of programs. They have lots of parenting materials in the library. They have flyers of the things that are happening around the community. They do lots of things. Other things, children's programs like children's museums or other things like that. Parks and recreation. Some religious organizations offer parenting programs or activities. Websites, local parenting magazines, the WIC program, special needs groups. Children's Hospital does a lot of parenting kinds of things. What other ideas do you have in your community? So we're going to take some ideas maybe, and maybe we could put those on a handout that we could send out to people? Could we do that?
Take ideas
Yeah.
We
from,
want them to give some
Yeah,
info.
give us some more ideas of what's going on in your communities. Can we do that?
so you want them to type that in?
Yeah, type in some other resources that you have in your community. Another one is the county extension offices do a lot of both screening and parenting workshops. So if you have a UW extension in your community, that's a great thing. A lot of communities have parenting blogs where parents can get together or do play groups or things like that.
Birth to 3, did you say?
Yeah, I
that?
said birth to 3. That's great to hear.
Do you want me to read any of these, or we're going to send these out?
Yeah, we can just.
Let's just send them out because we're running
Lots
low
of
on
them.
time.
Thanks.
Good.
That's
Well,
awesome.
and we will share with everyone what we get. So we're on to action planning.
Yes.
Now that you've gathered all this information, what are you going to do with it?
And so our recommendations would be that you begin simply. And so I actually, while I just give you a little pep talk here, I would like you to think about something that you could do. Like, what would be the first step if you want to engage with that one family that you've been thinking about and you want to get to know them better and see how you can be less frustrated? What would be the first step? Would it be sitting down and having them complete an intake form that talks about their family culture? Would it be having, even if you don't really do parent-teacher conferences with all of your families, would it be maybe meeting with them one-on-one to just have them give you some input about their child? Maybe you're already doing those things, and so maybe for you it's time to move on to the next step, and it would be simple enough for you to organize a family night or a parent education evening. I mean, maybe that would be a simple thing for you. But I'd really like, if you feel so inclined, that you would type in a response now about what is something, and we're not going to read these back to you necessarily. Well, we'll read some of them. But what would be a simple way to start? We would also encourage you to be persistent. Remember that some people will be harder to reach and understand and relate to than others. That doesn't mean that that they aren't interested in it. It might just mean that they have had some experiences that make it harder for them to trust, to believe in. Maybe they're new in the community. You might know that they're new to your center, but do you know that possibly they just moved from another state or something? So be persistent, but also with that, be respectful. If they indicate to you that they would like you to back off in some way, maybe scale back your efforts to connect with them. But I would still encourage you to, like Jean, continue to send notes home, because you don't know who that's going to have an impact on, even if it doesn't appear that they're responding to you. And then also build your network. Connect with the people who work in the same building that you do, other teachers in classrooms at your program. If you're a family child care provider, reach out to other family providers. If you don't know any, or if you think that that's going to be too difficult, contact me, because I have worked with 2 or 3 other family child care providers in the state of Wisconsin who have said that they would be very willing to work with other providers, other family child care providers, even if it means they need to travel. And they have demonstrated a real willingness to be involved in supporting other family child care providers, because we understand that that's a lonely place to be sometimes. So maybe we've gotten some simple ideas for how to begin.
So several questions around the theme of, several responses around the theme of doing a survey or a questionnaire that asks about likes and dislikes or interesting things that they want to share with their center.
Excellent idea.
A couple one-on-one suggestions: meet with a parent for a one-on-one discussion or have them visit the classroom to see their child in action.
Okay.
I'm going to work on my body language.
Awesome.
Jody.
Wonderful. Yay, Jody.
Jenny says we work with our local Optimist chapter. That's
Oh, that sounds
I've never
awesome.
heard that. Okay.
Yeah, that's a great one.
Start with small talk and go from there. It's interesting, Jessica. Share stories of you and your child, and then they might open up about stories of their own childhood or their own children.
Good one.
Ask questions. create a bond. Oh, here they come flooding in.
Awesome. I wish we could all be together in person, because this is when it's really fun, when people realize how many things they already know, and they can actually start out with.
And how it only takes something very, very simple. It doesn't have to be a grandiose plan.
Yeah, just a couple more. We're starting a parent resource room.
There you go.
Excellent.
That's great.
And Nancy says, I'm going to start by rephrasing what parents say back to them.
Awesome.
Great.
Well, one other thing I would say, if you can get your hands on the 2016 evaluation criteria for Youngstar, the family engagement point has become very robust, let me say.
Well, and where do they find that?
You can find that if you go to the Youngstar website, the public site, and if you click on the For Providers link, and then that will be a link across the top of the page or near the top of the page. And then once you've clicked on For Providers, there will be menu choices down the left-hand side of the page, and just find the one that says Evaluation Criteria and go on there. And then there will be a different version for school-age programs, for group child care, for family child care, and for day camps. But go ahead and look at that document, because in the 2016 version, the 2015 one is probably still available on there as well, but the 2016 one took what used to be 6 options for earning 2 points in 2015 and previous years and expanded that to 43 options. And so even though that's going to look overwhelming to you, it's like 12 pages of content, what I can tell you is that it includes a lot of examples. A lot of examples. And we worked hard when we came up with those ideas and as we wrote those to try to provide examples that you, so that would prompt you as you try to earn those points.
So you don't need to have all of them.
No,
No.
But look through it. Pick 10 of them.
Ideas.
Pick 10 and say, I'm going to, some of these are things we are already doing.
Right.
Some of them give me some language to build on. But don't be intimidated by it. That's what I'm trying to say, is use that. That's a tool and a resource for you. And it might inspire some ideas for things you can do in your program. Also, never, ever, ever be afraid to reach out to anybody you work with related to Youngstar, whether that's your technical consultant or a formal rater or your professional development counselor. Even if you're on the phone with somebody from the microgrant department and you are inspired to ask them a question, I promise you that they will put you in contact with the right person. But don't be shy. Your Youngstar people are here to help you be successful in engaging families.
All right, so as we close, we have a cute little poem here that talks about what? It is cute. A cute little poem that talks about how we stay connected together as educators and families.
And we're not going to read it.
We're not going to read it. It's for you to read.
Yes. And you have this available in an email. Andrea, before the first webinar, our day one, Andrea emailed you some things, and this poem is included in that so that you have that available to you.
It'll also be in your slideshow here.
Yes,
Yeah.
but it will be very hard to read in that format. It's very tiny. Here, again, is our names and our email addresses. And this, you will have these links as well, so you can click on that, excuse me, when you get the PowerPoint. So that'll be, instead of having to type in those long email addresses, please, please, please reach out to us. We want to help you.
So there are a few specific questions that
Okay.
I have held, thinking we would come back to them. So I wanted to say that this is the official end. We're finished. And when I said the email would go out an hour afterwards, what I meant is it'll go out an hour after I close it out. So if we stay here for 10 minutes, your email is going to come at 9:10, just so you know. And so I'm going to go back through and ask some of these specific questions so that you can get answers to them. So please stay on the line if you're interested in hearing a little more. And if not, everyone's welcome to be finished for the night and focus on your families. So thank you for your participation.
Thank you very much.
Good night.
Rebecca and Jean. Okay, there's just a few that I just wanted to share because, can you just say a little more about maternal depression? What exactly do you mean by that?
Well, often people would probably call it postpartum depression. So many of you may be aware that after having a baby and there's significant hormone changes in a woman's body, and sometimes brain chemistry can be affected by those hormone changes and can trigger a type of depression that is not the same as a more like clinical depression that might be experienced at other times. And often maternal depression or postpartum depression creates a barrier or a challenge for the mother to bond with her child. She may not feel as close to the baby. She may not want to spend time with the child. And it's not because she doesn't love the baby. It's because she is struggling with some chemical changes in her brain.
Yeah.
Right. And it almost always passes. It definitely should be treated. You should definitely, if you are aware that a mother in your program is struggling with this, or you think that a mother might be, I would always encourage that they be in touch with their doctor about that, because it is something that should be watched and it can be treated, but the doctor needs to be monitoring that. Is that helpful?
I think so, yes. Couple more food things that I thought would be good to mention. Somebody said that she has a parent who only has so much formula a month. Somebody on WIC, and so that's just something that she's challenged by in terms of food.
So what about resources in the community? There are usually food banks that can add to that. The food program supplies formula sometimes. WIC.
Some pregnancy centers I know do that. Yes.
Yeah. So I would look into your community, and the health department is a wonderful place to start with that and find out where you can get more.
And I know my husband and I own a farm, and so I know that during farmers market season, you can use your WIC coupons, not for formula at farmers market, but if you're also looking to spend those dollars on fresh, nutritious produce. Yes,
Right.
Farm vendors are able to accept WIC coupons at farmers markets as well. And I also know that many farmers will give food away if they can. I know we donate food to food pantries in our community so that fresh food is available there, but don't be afraid to ask at a market.
Yeah, but food banks will have extra formula.
Deborah had a couple questions about, I lost them. She talks about a boy in class that wrestles a lot, and that's coming from home. There are older siblings at home, and so there's aggressiveness that she feels is being reinforced at home. Any suggestions on that?
I would suggest there that you have a conversation with the parents, really, and get the parents on board with, help them, first of all, maybe help them understand that this might be a difference between the culture at home and the culture at the center. And you do have the right to say that some behaviors are not allowed at your program. So just because it's okay at home,
figure out that there's accepted behaviors here and at home. So it doesn't mean that you're telling parents that wrestling is not okay at home, because boys do need to wrestle, but that there are accepted behaviors here and there.
Right. But I think that this is definitely something that you really need to engage parents with.
Oh, yeah.
Because you won't probably be successful just on your own. So this is a really great, this could be sort of your gateway experience for working together with a parent to reinforce what's appropriate at the program And remember that if this is a child who's demonstrating aggressive behavior, and it might just be playful. He may not be being aggressive. I don't know this particular child, obviously, but there are, let's say, 10 other children in the classroom who it might not be their family culture to be expressive in this way. And when you are running a classroom or managing a group of children, it's your responsibility to meet the needs of all of those children. And it might be that you need to protect those other children. And so communicating that to the parents in a very respectful way too, that, I mean, there's lots of kids here and not everybody is comfortable with this. So working together to do that.
Here's something. Jessica's struggling with giving a 10-month-old 4 ounces every 4 hours because of a doctor's note. But he always seems so hungry.
Yeah.
Mom says to feed him more mush and table food, I think. And so
Okay.
is this appropriate for his development? She thinks he's extremely emotional. And she doesn't want to upset the parent by making him a bottle and her getting upset or think I'm feeding him too much. If that makes
How old
sense.
is the baby?
10 months old.
Oh, 10 months old.
It seems like a 10-month-old
Should be going more.
should be eating more than 4 ounces every 4 hours. But again, this is, I mean, we don't know this child. And so what I would suggest here, since you have a doctor's note, is I would find out how old the doctor's note is for starters. I mean, if it's from when the baby was 6 months old, I would suggest it be updated for current. I mean, babies in the first year of life are, I mean,
Yeah.
the growth is dramatic. And so maybe revisit that. And, you know, some of the conversation we had earlier about food, some people push food on their children, and that can be cultural. And other people can be very concerned about children being overweight and may not feel comfortable feeding their children as much because they don't want to have, you know, they don't want to have a child that they perceive as overweight. So since this is a parent that's clearly engaged with the doctor, at least at one point, with regards to feeding patterns, I would suggest that maybe she ask her doctor, just, you know, I would probably reflect to the mother that the child is indicating that he's very hungry and you'd like to feed him more. Find out why the doctor has said not any more than this and if that's a current need.
Right, because we don't know if that's a physical.
Right. And I don't know if the baby's crying because the baby's hungry or if the baby has some underlying issue. I can't begin to guess, but I would really encourage getting an update from the doctor. That would be my first thought.
Lots and lots of thank yous. I think that's about it. So
Great.
Well, thank you to everybody who participated the last time and this time. It would have been wonderful to meet you all in person. I hope we have the opportunity to do that sometime. And remember to reach out to us if we can help.
thanks,
All right.
everybody.
Good night.
Good night.